Good afternoon, everyone, and thanks for joining One Health Academy today. We've got a special edition. We've always met in person at the Capitol Yacht Club traditionally in DC, but today, thanks to our lovely guest speaker, we're able to do a virtual webinar here, and through the help of One Health Commission, provide this GoToWebinar platform for our guest speaker today. So One Health Academy is a group that meets typically monthly and provides a place to network and collaborate and mentor around issues relating to One Health, so human, animal, and environmental health. And so our speaker today is a great model of that. Dr. Wondwossen Gebreyes is the Hazel C. Youngberg Distinguished Professor of Molecular Epidemiology and Executive Director of the Global One Health Initiative at The Ohio State University. He also co-founded the International Congress on Pathogens at the Human-Animal Interface and currently serves as the chairperson. So he's been actively involved in this realm for a long time and has a great deal of experience and knowledge to share. So for this webinar, he's fine with, if you have questions, feel free to use the chat or questions box on the GoToWebinar platform. And if you're on the phone, we'll also unmute everybody at the end of the talk and you can ask questions that way as well. So with that, I'll turn it over to Dr. Gebreyes to start our talk today.
Great. Thank you so much, Will. And hello, everyone. I realize there are people registered from different parts of the US mainly, but also East Coast. Definitely, we miss the cherry blossom in Washington, DC, but great opportunity to be with you over technology webinars and share with you today, as you all can see on the title, really the building capacity at the same time, really making grassroots impacts using the global One Health model. So what I plan to do today is mainly give you a little bit of background, many things that you might be familiar in terms of the One Health world, but also considering the evolving global One Health paradigm aspects. And then after a few slides, I'll share with you specifically more our program at our strategic global areas in terms of the Ohio State Global One Health Initiative. Just to start with, I am sure everyone by now is very much familiar with this characteristic slide from the World Health Organization. Indeed, I'm not going to repeat it, but overall zoonotic diseases, whether you are from the public health discipline or veterinary medicine or physician or social science, others, zoonotic diseases remain very important and often from the One Health implementation standpoint has served as the low-hanging fruit. And of course, with all the emerging viruses and vector-borne diseases and others, it's critical and always remain a very important aspect of One Health. Little bit of history in terms of how we got to the One Health term and zoonotic disease. Of course, ages, zoonotic disease has always been important, but one very important scientist, Calvin Schwabe from UC Davis, coined the term in veterinary medicine and human health. That was a book from his 1984 book you see on the left part of the slide, which of course brought One Health into that phrase or terminology that we are using today at the interface of human animal health, but also environment, other aspects. On the top right, you see another book from the University of Pennsylvania, 1799, published in 1799 by Benjamin Rush as part of his lecture series, and his students really pushed him to publish it as a book. And my colleague, Dr. Peter Cowan from NST, shared very nice thoughts there, which clearly indicates the need for human medicine and animal health work across the disciplines. Those being true, on the bottom also, I show you from my own experience as someone, a veterinarian who practiced veterinary medicine in the pastoral areas of Ethiopia in the early 90s, integrated health human as well as animal health service delivery has always been a common practice. And that's true in many pastoral and other nomadic settings. So even though we never called it One Health, in practice, One Health has been around for decades. And you see my own picture with our part of the rural part of Ethiopia during early part of my veterinary practice there. Fast forward after quite a few decades, at least since Schwabe coined the term, with all the globalization and the current global dynamics, we are facing, this planet is facing a number of pressures, right? I think you agree with me. And of course, as published by the Global Risks Forum report in 2016, there are a number of factors, the whole dynamics in the world that makes One Health not just an option, but it's really a necessity to sustain this planet. Of course, the population increase is tremendous. Currently, more than 7.5 billion of us in this planet, heading 4 to 10, perhaps up to, depending on which estimate you read, 11 billion by 2050 in this defined planet. And according to the Risk Forum report, you see on the graph as well, water crisis, global travel migration, we hear it now commonly on the news, biodiversity loss, urbanization, so many factors are playing a role that also change the animal, human, environment, plants, pathogens dynamics. So One Health is becoming more and more critical. So our way of doing business also in terms of One Health need to evolve with this global dynamics. A couple of examples, of course, climate change, very clear, very direct relationship with health, particularly with respect to vector-borne diseases. And we all hear, right, the changes in whether it's re-emerging diseases such as chikungunya or dengue or Zika as are emerging, or strains that are changing its form. There are so many diseases that are of direct relationship with climate change. So these are very important. And just a few days ago, World Health Organization was showing additional deaths of 250,000 people per year because of climate change. So these are all important dynamics beyond the direct zoonotic diseases. Another thing very common since about middle of the 1960s is antimicrobial resistance, and now becoming in fact a huge global burden and getting more and more attention, but a very clear One Health concern as well. And this estimates, I hope many of you have seen this, by 2050 an estimated about 10 million people die of antimicrobial resistant strains. Again, this is not a classical zoonotic disease model like rabies or others, but highly important One Health concern at the human, environment, animal, plants, and others. So this is whether it's in community settings or nosocomial settings or food safety, it's hugely important concern. Another one, this is from the Institute of Medicine National Academies that was released perhaps 7 years ago, but really it hits home in terms of the breadth of One Health. And clearly still on their website, if you see it, they clearly show One Health and the need, relationship with food safety. There is no animal and directly you see here, but there is lots of things involved here. The trade, food trade across the planet, the role of the environment in produce, and in this case, a bowl of salad in an average US restaurant, part of depending on which ingredient you are looking at, it could originate from 33 different countries. So we live in so much interconnected world, which brings One Health into much more broader dimensions than what we have been just a few decades ago in 1984. With the UN Sustainable Development Goals, of course, there are 17 goals. If you look at the goals and how WHO also aligned it, One Health has, to me, the way I look at it, has at least a role in 10 of the 17 Sustainable Development Goals, whether it's malnutrition or water sanitation, antimicrobial consumption and use and resistance, food safety, environment. So, for all of you and all of us working in the One Health arena, definitely kudos that I think what we are contributing is of tremendous significance to this planet. But it's a long way to go. I mean, we're just, we are addressing a very small part of the whole dynamics of the planet, but we all have a clear role to play, whether we are in the health science disciplines, or we might be in the environment or plant health, or social sciences and others. So what I kind of said wanted here, but more of a thought for all of us, is a broader definition of One Health. We see inconsistency or a narrow definition, lots of variable definitions of One Health, but One Health addresses so many different areas. In 2015, you see this graph on the right-hand side, a circular one. There was a meeting in Davos in a global risk forum. Quite a few of us attended and participated in panels and discussions. Interestingly, most One Health meetings, there is a large number of veterinarians, I have to admit. But in this case, the majority were environment people, mainly from the UN Environment Agency. But also quite a few of us from some physicians, some public health and veterinarians. There was very interesting discussion, and really brings together not only just the central players of human, animal, environment, but also what sounds like peripheral but highly important issues: water, sanitation, urbanization, climate, and others. So I think this is a very broad area that we all need to consider and embrace as we communicate and work in the One Health dimension. So with that more of introduction, I would like to get you into what we feel from Ohio State Global One Health Initiative point of view. What is a compelling global challenge? As you can see it in this statement, we believe an integrated approach is key. Building capacity. Capacity is so, again, that's so variable depending on which parts of the planet we are talking, but the issue is a global issue. So building capacity across the planet is key. Of course, the goal is to mitigate diseases, but not only diseases, there are a number of other associated hazards, whether it's chemical hazards at the interface and others. And the science and policy aspect is also critical. However much we do science and publish it on Science or Nature, unless there is an effective policy, making a difference becomes very tough. That's something I learned through the last few decades. And of course, the key focus is that interface or between and among humans, animals, plants, and the environment. This is the overall overarching global challenge. We look at it from our standpoint, our small contribution, but I think, even though we do not have this planet, I'm not aware of a consistent one crisp but comprehensive definition of One Health. I believe this addresses part of that, definition, something maybe for consideration. So with that in mind, let me get more specific into our One Health initiative, Global One Health initiative. Our vision is building capable institutional systems and professionals with the ultimate goal of healthy, not only healthy, but also enduring global community. You might be dealing with livelihood, quality of life, and others, and in addition to saving lives and morbidity and mortality kind of aspects. So with all due consideration to the 17 Sustainable Development Goals, which quite a number of them deal with One Health. Okay. Happy to answer any questions, by the way, on the background aspect. If anyone has questions, but I'm going to forge ahead. So in our Global One Health initiative, first off, I want to share with you that we have about 13 colleges are involved, or more than 30 disciplines are involved. Classically, with a classical definition of One Health and zoonotic disease, of course, it's a bit narrower in terms of veterinarians or human physicians and public health are the key. That remains the key, but a number of other disciplines, all the 7 health science disciplines plus communications, of course, food, agriculture, environmental sciences, social work, human ecology. We have business, very important in terms of supply chain, logistics of vaccines, others, engineering, biomedical engineering, software engineering. We have a large number of disciplines involved in our One Health initiative, and I'll give you some examples today. The key focus of being academic institute as a university, of course, our key emphasis is capacity building. Anything we do has something to do with capacity building in any of the project, whether the project is a research or an outreach type or educational project, building capacity at the core of our vision. From the outset, when we established our program, we agreed that it has to be mutually beneficial. It's not like a humanitarian or this is a partnership, mutually beneficial between Ohio State and our strategic global partners, which I will list some of them later, but just to tell you from the outset, most of our activities has been in East Africa, Eastern Africa, Ethiopia, one of them, perhaps the most activities we have, but also Brazil and Latin America, Mexico, Central America, some of our colleagues to have work, as well as Southeast Asia, Thailand particularly. So I'll give you some examples. Again, capacity building being very important. We have a number of short-term type of capacity building activities. One of our flagship activity is a One Health Summer Institute. We do Summer Institute every year in Eastern Africa, particularly, but we have also some outside of the summertime in Brazil and Asia, some workshops, others. But key activities since 2012, we have been in partnership with a number of various regional, local partners. We've been doing One Health Summer Institutes. So this year, it is the 7th annual Summer Institute. We were discussing this morning. In fact, we have about 43 to 45 professors traveling from US to Ethiopia, and mostly we host it in Addis Ababa, but the participants come from the neighboring countries as well. For the first time this year, we received requests from various other US partner universities. So we're very happy to involve other US partner universities. I think to name a few, Cornell, UGA, University of Florida, one of our collaborators, and others will also be participating in this Summer Institute. But besides the Summer Institute, long-term capacity building is key, and we believe that's crucial to sustain our success. Our goal is not always a US institute to go and train partner institutes, but to make our partner universities be capable and be able to handle themselves. So we have a number of long-term capacity building projects. One example here is led by Dr. Armando Hoet. Our veterinary public health director is in veterinary medicine, educational twinning between the University of Gondar, Ethiopia, and Ohio State. In fact, even though the lead Ethiopian partner is Gondar, it's benefiting about 11 different veterinary colleges. We have a similar program in nursing as well, a nursing program, and a more multidisciplinary program at the PhD level also we have that I will show you later. Not only, of course, our capacity building, again, program not only benefits our partners, but also our students, where it's a mutually beneficial partnership. We would like to inspire and build capable professionals, and that means it doesn't mean that just for Africa or Latin America or others, but our own students and faculty members build their capacity in terms of global perspectives and complex issues in the world, and learn culture, contribute, do service learning. So you see some of our students here. In fact, the Dean of Social Work, I can see him on this picture as well, some nursing students, as well as veterinary students. You see on the top right, Kelsey Gerbig, a few years ago in the pastoral area of Ethiopia. So we just want to mention it's a mutually beneficial, a two-way process. So cross-fertilized knowledge is what we want to have. Again, mutually beneficial. Number of projects we have here, a little bit busy slide showing you the number of projects we currently have in Brazil and East Africa. They're all mutually beneficial global priorities, and we'll give you some examples, but it shows you the breadth of the projects from various areas. One of the fairly large projects we have is focusing on the global health security agenda. As most of you know, there are about, I think, 11 agenda items, all of them critical. Many of them fit, perhaps all of them, but I know for sure many of them fit into the One Health paradigm. So we have been working through a cooperative agreement with the CDC in partnership with the Ethiopian Public Health Institute, implementing a GHS agenda in 3 areas mainly: in rabies prevention and control as part of the zoonotic package. Brucellosis is another important issue, also prevention and control, and antimicrobial resistance. In addition, you see a 4th component here. Anything we do technically, it's a very important aspect is adjunct skills or the leadership skills and communication capacity, other aspects. So really to make it effective, to enable our partners work across discipline boundaries, work across administrative boundaries, and for all our co-leaders to work effectively with our partners in Ethiopia, we have a component of leadership and communication capacity. Here is an example of, part of the activities associated with the global security agenda. Again, grassroots impacts while building capacity. We build capacity of our partners and our students, but at the same time make grassroots impacts, saving lives through the rabies prevention system and mass vaccination. Our team members, wonderful cadre of very committed professionals we have from Ohio State and Ethiopia side, as well as CDC. I believe they vaccinated more than 9,000 dogs as of last year and continuing that. We work with 16 different institutes, by the way, in Ethiopia, and some of them are like the Ministry of Livestock and Fisheries, the Ministry of Health, besides the academic institutes, so who are taking over and continuing with the rabies project, as well as brucellosis, Mycobacterium bovis, and other projects we have. Another one is a regional project in Eastern Africa, One Health Eastern Africa Research Training Program. This is a partnership sponsored, funded by NIH Fogarty International Center. We work on foodborne, waterborne, vector-borne diseases, as well as, if you see on the bottom, the gray side, focus areas such as antimicrobial resistance, or rapid field deployable like point-of-care detection systems, and expanding capability in terms of genomics and bioinformatics aspects. Once again, all of these are interconnected also with our One Health meta leadership, scientific communication, and other aspects, which again is crucial. Just to show you some examples of our former fellows, which all of these are already graduated, but we have a lot more examples of these, but on this slide you see some of our key partners from Kenya, Ethiopia, and Tanzania. Like Joshua Mimo on the top left, you see he is now a faculty member at the University of Nairobi, a former PhD fellow, porcine rotaviruses work in pigs that he's done wonderful work, and he published a series of articles. He is now capable PI, he is now a collaborator, and in fact a key member of our Global One Health Initiative work. Other examples also listed here on Campylobacter. We work on MRSA and HIV interaction in humans and animals in Kenya and others listed here. There are some examples of our work, but our work in this program started in 2010. It's renewed recently, continuing through 2022. There are a lot more PhD trainees, fellows that are joining, as well as postdocs, and short-term trainees, a large number of short-term trainees, because our goal is on this program is building the critical mass of scientists who can build their institute's capacity to be able to address foodborne, waterborne, vector-borne diseases. Another project here, I'm kind of going fast quickly to give you a snapshot, and hopefully we'll have a chance to discuss more, is in Central America. This is also led by faculty members from Ohio State, involving antimicrobial use and antimicrobial resistance in agriculture in Central America and South America as well. That's led by Dr. Armando Howitt, who is also leads our twinning program I mentioned earlier. Another project we have in Brazil, initially funded by the US State Department as one of the Global Innovation Initiative flagship projects, still active project, but we're just completing soon. It's a scientific mobility project that included US Institute of Ohio State, Brazil, Federal University of Paraíba, and a United Kingdom partner. State Department funded in so diverse areas, so we're happy to be the one selected from One Health project. Our title was Strengthening One Health Research Training Capacity using Antimicrobial Resistance as a model. That project not only facilitated scientific mobility of graduate students and faculty between the three countries, but also it gained attention. So now we became part of a 5-year national antimicrobial resistance monitoring program in Brazil. So it's a Brazilian national AMR program that we are part of, that's funded by recently funded by the National Science and Technology Council, CNPq, that you see at the bottom. You see my collaborator and myself is Professor Celso Oliveira. A couple of weeks ago, there was a program at the US State Department where we had very interesting panels across the this global innovation issues generally, not only ours, but the various selected projects. So that's one aspect of Brazil, but we do quite a bit of work in Brazil. Tying our work in Africa as well as in Mexico, Brazil, Thailand, which I did not mention, don't have much time to go in depth, is this partnership. What you see on this slide is the Genome Tracker Partnership. This is a partnership between our global consortium and the FDA CFSAN, Center for Food Safety Applied Nutrition, the Genome Tracker Program. Our agreement with FDA is really looking at 1,000 multi-drug resistant salmonella and do a comparative whole genome sequencing analysis. So as you can see, there are a number of countries that contributed salmonella isolates, which are multi-drug resistant isolates. So this is the beauty of global work, is this kind of project allows you to do a comparative assessment of how multi-drug resistant strains can transfer or get across the planet from one continent to another one. So number of PhD fellows are working on this project, even this one project, but great project that connects our South partners as well as with Ohio State. Another aspect, maybe I'll take a couple of slides and tell you, is with all the overwhelming and wonderfully interesting interest and commitment across the planet, it became clear to us is to make our activities impactful and sustain them. The use of digital technology is key. With all the online learning type of systems, a few years ago, our university put some commitment to initially And later on, NIH Fogarty joined on electronic capacity building. So one of our projects is on e-capacity building on our One Health area. So you see these 5 online courses. Initially, we started with using the iTunes University platform of the Apple system. We face some challenges, as you can imagine, in many developing regions. It's not easy to get the bandwidth, and iTunes U and Apple products are expensive, and so on and so forth. So about a year ago, a private industry, Canvas, which is a major online learning platform globally, was interested to launch our Global One Health initiative as one of their selected projects and hosted a portal at the Canvas at their own site. So we have now, between Ohio State and Canvas, we have a great partnership where you can see the web page right here, which I took a screen image at the Canvas site. The Global One Health initiative courses are being lined up. Still, it's a work in progress, but a number of courses, as you can see here, are freely available for those globally, any part of the planet, who want to learn about farm-to-table food safety or science of cancer or molecular epidemiology. These courses are freely available to you. What we are doing is also is expanding this into a certificate program, Global One Health Initiative. So there are 2 links you see here. So recently, we have been working on Global One Health certificate type of program at Ohio State that we will eventually roll out for our global partners. Right now, the current program is only limited for Ohio State graduate students who want to get a certificate, but in the future, we hope to evolve it into an online format. So any of these courses for free are just knowledge. You gain knowledge, which is the most important part. But if trainees or anyone wants to get a credit or a certificate, then that's a different story. You need to get registered through the university system and so on and so forth. But the online aspect is still work in progress, but we are very much excited that we're launching and we created this public-private type of partnership. So feel free, please, to share this if you know any colleagues who want to learn about any of these or want to know more about it. Mobile health, and as part of this electronic capacity, is very important in our research data collection or other aspects. We use mobile health aspects in our global health security project. In other projects, we use various electronic survey data collection tools, for example. Or, as you can see here, a partner from Ethiopia and Sharon Kim, one of our former veterinary students, are using this iPhone-based tool in Gondar, Ethiopia, to measure the contamination of milk, the somatic cell counts of milk right on the spot at the farm, in the dairy farms, and showing the farmers right there that the milk is contaminated or not contaminated. That has a big another advantage for us in many of the projects we have. Often farmers are not willing to collaborate with university professors because you go there, you collect data, but they never hear back from you, and you publish it and you get tenured or something, but the farmers don't get the results back. So this is the kind of thing that's very much advantageous, the use of technology to have it right on the spot and show them the results. On a related note, on tuberculosis, really this is translation from whether it's lab to bedside or lab to farm. One of the projects, we have 2 projects on tuberculosis, both in Ethiopia, but also the second one on animal-borne tuberculosis. We're working in China, recently expanding to China as well as Brazil, as well as a rapid field deployable detection system for Mycobacterium bovis, which we adopted a system from the Mycobacterium tuberculosis from Human Hospital here in Ohio. So our physician scientist, Dr. Sue Wang, has been in various dairy farms with me in Mexico, in the US, as well as in Ethiopia. testing this system that we adopted from the human medicine, which seems to be working very well. Again, field deployable. It gives you, within 25 minutes, it gives you whether the milk is contaminated with Mycobacterium bovis or not. Still work in progress. It's not perfect diagnostic platform, but it has a good sensitivity, good specificity, with some other limitations, but we're very much excited. So this is the kind of work we'd like really to promote in terms of implementation science. You know, I can continue with a number of projects, but this is another one on cancer-related Epstein-Barr virus. Oncoviruses are very important. It's infectious disease, but also at the interface of chronic disease, cancer, and we have a project that's funded by National Cancer Institute. Rob Baiocchi is the PI from our side, but it's building capacity at the same time developing a vaccine against the Epstein-Barr virus. With that, just want to mention we have a global platform that Will earlier mentioned, the International Congress on Pathogens at the Human-Animal Interface. Right now, if I am not mistaken, we have about 1,100 subscribers from 356 institutes in close to 90 countries. The inaugural one was in 2011 in Ethiopia. You see the picture from the inaugural one on this slide. But every 2 years, we host the ICOFA. So the first one in Ethiopia, the second one was in Brazil, 2013. 2015 was in Chiang Mai, Thailand. 2017 just wrapped up last November in Doha, Qatar, in the Middle East, so in 4 different continents. So we're very much looking forward for 2019, and Canada, North America is going to be the host, and Canada showed interest. So we're working on that. Just in case you are interested, please let us know. But this is a wonderful Global One Health knowledge sharing platform, and a number of research partnerships, interactions came out of the ICOFA partnership, and we're very much excited about this. So yeah, whatever we do is highly measurable, and I'm just a speaker, but the credit goes to a number of people all across the planet who are doing really the groundwork on making impact. But large number of partners, institutional, individuals are involved to make the difference. So whatever we do is really as measurable. And of course, our Global One Health Initiative team, we have really incredible office team, both in the US. You see at the bottom left side, quite a few of us are in the US, plus our regional director. But we also have now a regional office opened and launched last year in Addis Ababa, Ethiopia. So we have, you can see on the top right-hand side, perhaps half of our employees in the regional office. But we have a large multidisciplinary team based in Ethiopia, in Addis, but working regionally. Some are physicians, veterinarian, data managers, public health, pharmacists, quite a couple of pharmacists, and a number of wonderful, truly a Global One Health team. And without all this incredible team of people, we couldn't have achieved anything we've been doing. I'm very much happy with our team, and we, of course, we're just starting. We have One Health has a much longer journey to go, as you can all imagine. And before I finish, I want to remind everyone, as many of you know, there is a Senate bill advancing emergency preparedness through the One Health Act. That really, we absolutely very much, all of us have to really support it and advocate for it, and reach out to our senators to make it happen. But definitely, I really encourage you to communicate with Dr. Bernadette Dunham, based at George Washington University, former director of the FDA Center for Veterinary Medicine. And the One Health Initiative webpage has more information, but we're at Ohio State, we're doing our due diligence supporting this and advocating for it through our government relations office. So this really need to be, we very much look forward to see this will come through and realized. Finally, I would like to really thank all our wonderful sponsors particularly all the various US government agencies, USDA, NIH, USAID, CDC, FDA, and a number of our NSF as well as a number of our global partners. So thank you so much for your attention. Appreciate it. So I'm happy to take any questions.
Thanks a lot, Dr. Gebreyes. And then just for your reference, I also put the handouts from that Cheryl Strada sent from One Health Commission on the bill into the webinar as well, too, for people to have access to how to communicate with your legislators and support the new One Health bill that's trying to make its way through.
Excellent. Yeah.
Thanks for the very comprehensive presentation too. If anybody has questions, feel free to either use the question box on the GoToWebinar, or you can raise your hand virtually and we can unmute you. Welcome to ask those questions. I had a quick question for you to start off, Gebreyes. So for the One Health East Africa work that you've been doing, especially with the research and university partnerships, has there been much coordination with OSIA, the One Health Central and East Africa network that was put in place by USAID a few years ago?
Yeah, very good. Yes, excellent point. With OSIA, in fact, yes, we do have quite a few of OSIA network members are already collaborators with us as well. We have great relationship with the office in Makerere at Uganda, as well as we kind of co-hosted different workshops. Most of the participation from OSIA group has been during our summer institute, because the activities of OSIA so far at least has been mainly focused on short-term workshops, capacity building, that kind of activity. So number of OSIA members has participated in that. Right now, with overall beyond even OSIA, the USAID EPT programs, we have a network of regional monthly meetings that are hosted by the various partners. So our Global Oneness Initiative regional office, in fact, the next meeting of that regional meeting will be hosted at our office in May. So we have that kind of interactions. The limitation a little bit has been, as I indicated in different meetings with colleagues at USAID, is we really want to focus on building capacity, which requires long-term investment in terms of PhD training, postdocs, that sort of thing. So I remember when OSIA was established first, I've been partly involved in informally advisory role, and we have been advising in terms of having this strategic, more long-term training so that we can hand off to the regional professionals in terms of PhD others. So that part is a little bit, it has a different scope because of the USAID EPT program. But yes, we have excellent interaction, yeah.
Great, that was a very helpful answer, and I figured that was the case, but wanted to at least pose it. I guess one other question as well I had was, as we tied to the second to last slide with the legislative work, and you were talking about one of the components for the group is, as far as GHSA, is leadership and communication. How has the Global One Health Initiative at Ohio State tried to move things forward in policy, and what challenges have you come across, and especially from a university perspective, and what successes or at least good trends have you noticed so far?
Yeah, excellent. That's an excellent question. Yes, that's wonderful. I have to admit that we have been a bit limited because of, to effect policy. I think one thing I learned is the science and the communication that has to really progress and mature. But one example I will give you is in our one of the model One Health projects when we started off in Ethiopia, and in fact, being my own research being on antimicrobial resistance, we're interested to engage the Ethiopian government in that, but the Ethiopian government insisted rabies would be the state minister. I remember telling us rabies is our big priority, it kills children, it's highly fatal. So we agreed, yes, great. So when we established that early on, we started navigating in the various potential partners. So we included the House of Representatives because a year before and engaging in mass vaccination. Of course, many things we do in the US may not be realistic, like dog leash policy or something may not work. But ensuring the policy makers early on to be on board and understand zoonotic diseases. At least we missed about a year of that, but we realized at least quick enough after a year that engaging the policymakers will be a key. So one of the 16 institutes, in fact, in Ethiopia that has been now actively involved is the House of Representatives Social Affairs Committee. Now, in fact, they added one more committee engaged in our partnership in the rabies prevention control. So the Social Affairs Standing Committee chair, the first time he came to our workshop, we thought he will make opening speech and leave after an hour or something, right? But he never heard of the word zoonotic, and he learned. He's been asking questions, stayed with us throughout. A very senior person in the legislative there, but very active. Turned out, Honorable Yosef Daimo is his name. Honorable Yosef has become a wonderful advocate for us in the zoonotic disease prevention control. Has we reached to really affect policy? Really not yet. That remains to be seen, but at least engaging policymakers and really recognizing zoonotic disease. So our rabies has been really wonderful. So yeah, I think that's a bit limited experience we have, but we definitely, that effective communication is key. Now, in the global health security, we're closely involved with the Ethiopian Public Health Institute that has also a regulatory role. So we're very much into the brucellosis aspects. Results has been very much encouraging from last year. So recently, I was not there, but our team members, our regional office, hosted a workshop that included policymakers and parliamentarians. That's progressing very well. So we very much look forward to influence policy slowly.
No, I think that's a great example, and I think that's the challenges a lot, I imagine, who are on this call as well face too is, most of us are likely scientists or come from science backgrounds, and trying to translate into policy it's a very big divide in a lot of cases. So I think it's great that it's on the radar and it's a strong initiative that you guys want to try and push for moving forward. Did have a question from Andres Vasquez, who is asking, could you explain how large is the proportion of physicians and veterinarians in some of the projects held? He's perceived that there's a stronger participation of veterinarians and other professionals than medical practitioners. And how has your perception and involvement of them within the One Health initiative been?
Excellent question. Yes. So let me answer that from the US standpoint on this side. And I think that's a very good question. We are definitely progressing, but in our, if you look at our Global One Health Initiative administrative structure, I happen to be a veterinarian, but the 7 executive committee members include, in fact, 3 of them happen to be physicians out of the 7 of us. Because the medicine is so huge with cancer, infectious diseases, children. So we have 3 of physicians as our executive body of the Global One Health Initiative. So we have a good participation. A larger group, we have about 42 advisory committee members. We have is from certain disciplines, so diverse. So it's not, again, I want to emphasize, not only veterinarian, physician, public health, but a lot more communications, business, others. So we have great participation from across the board of disciplines. And interestingly, if I tell you across the Atlantic in our East Africa setting, starting from a long time ago, One Health people in developing regions get it very instant, very quickly. Not just the perception, but also the realization. You don't need to explain much to convince a physician or the physician may convince you the need for One Health in Ethiopia or Kenya or Thailand. But it's kind of the reverse here, but I think it's progressing well. We definitely need a much more multidisciplinary active engagement. Our proportion in our regional office, by the way, we have about 25 employees now. But just to tell you simply, there are 3 physicians working in that office, 1 veterinarian. It's very interesting, but definitely we have a lot. It's 3 to 1. So in terms of the physicians and veterinarian proportion, and our regional director happens to be a physician, so there is great commitment. And you correct me if I'm wrong, but any part of the developing region I know are very instantly physicians get it. I think the way starting from the training system, the other aspects, there might be multiple factors, the day-to-day lives of humans in the developing region, definitely sub-Saharan Africa, heavily depends on animals and the environment, whether it is animals for starting from food, of course, but guarding your property or for transportation or other things. It's very much intertwined. So physicians are very much keen and highly involved in the animal health aspects, and vice versa. When I was in pastoral area, there was some meningitis outbreak. I think there were 2 nurses and 1 physician. The other person who can do some type of injection intramuscular was a veterinarian myself. So yeah, you have to participate, and I happily did. It's a different story if it was in the US, I understand. But we have to save lives from meningitis, so we all have to chip in. So there is variation. But I very much appreciate the question. But definitely, I'm very much happy with the progress we're showing at Ohio State. I can tell you, almost any physician or nurse or others we engaged in One Health are excited and always engaged. So we have a very large number of physicians involved now, and others.
Great. Yeah, and I think that's a good point about developing countries too, that as you said, it's a lot easier in many cases for the physicians to be on board, or oftentimes on board before veterinarians are in some cases. So I think it's a good perspective to have. Bernadette Dunham actually has been listening as well and wanted to know what were some of the biggest challenges you faced in establishing these success stories.
Yeah, excellent. Thank you, Bernadette. The biggest challenge, there are quite a few challenges, no doubt, but the biggest challenge I would say is, the wavelength, how fast things happen in the US system and in other countries is so variable, and the system, the paperwork, others. So things happen relatively much faster here, and things are much slower depending on the country in terms of how our partners or other, let's say, proposal is written, and somebody from our College of Medicine leading, I don't know, let's say pathology, some leishmaniasis, other things, and wants response in the paper. There is some level of difference, or the sense of time when we are in country and training, and we tend to be so prompt in the US. So we expect everything to be like that. So people's expectation always, I myself and our Global One Health team members has to kind of facilitate and make people understand. In fact, we have a motto. What we tell people before they go from here is, maximum flexibility, minimum expectations, because you have to, otherwise you'll be frustrated. You have to be so flexible in working across cultures in a different setting. So I would say that's overall a challenge, but not insurmountable. It has not been a significant challenge. Overall, there's so many positive things outweigh that challenge, but that's something that comes to mind.
Thanks. And I don't see any other questions right now, but I do have one more for you from myself with regard to brain drain and concern of that. So, obviously with the research and training program in some of the East African countries and trying to get people to their terminal degree or at least further training, is there a concern about them staying in that country and continuing to contribute once that training is completed, or what sort of feedback or relationships have been developed to kind of ensure that they hopefully stay in that location?
Yeah, that's very important issue, and that's one of the key questions we discussed with NIH when we first established our program. I think number one, we knew it was during the time I was young and when my brain was trained here too, but when I left Ethiopia 25 years ago or something, at that time, there was a huge rate of brain drain as compared to now. Many people go back and contribute and things are a bit different now. One, just the situation there. Secondly, we did our own also mechanism to minimize brain drain. One way we did it is we established our PhD program is not like we bring in someone from Ethiopia, Kenya, or Tanzania, or Brazil and do Gebreyes lab work, Ohio pig farm or chicken farm or something like that. We always, number one, it's a sandwich program where people come for part of the time to do a mentored research, build their capacity in terms of coursework, in terms of identifying advisors, developing dissertation, then go back to the home country, address a problem to the nation or to the region. So, Joshua, Mimo, any of those I showed you, they work on problems of the country, which is very good. It helps the country, also the planet, because these are all global issues. Secondly, through our sandwich program, they come for part of the time. That was the model NIH very much liked, and in fact, a few other universities are following that sandwich type of training model. That's the second way, but overall, I think, honestly, the attrition from Ethiopia has been relatively higher, but from Kenya or others, people go back to the country consistently. Yeah, so that's been from Ethiopia. I think we hosted about, whether it's for short term or long term, in the last 5-6 years, about 80 some visitors, visiting scholars for short or long. It could be just for 1 week as well. Recently, we had an incident. 2 students did not go back to their country, so we did not necessarily due diligence reporting to State Department, other things that our office had to do. But part of the reason was that, as I said in our vision, we build institutional capacity, right? So mostly our visiting scholars or fellows or PhD fellows, they are not actual students of the partner university. They are actually employees, faculty members of that institute. They are students or fellow students for us, but they are actually employees of that university who are faculty members of that university. That also matters. This was the only and first project we brought actual students from the country, from Ethiopia, from one university, and out of 16 trainees that came on that project, 2 of them did not go back. So sometimes that could happen. But still, I think a great success, all things considered.
Yeah, definitely. Thanks. One last question here from Sona Jasani. Does your program utilize underrepresented disciplines, including those in the humanities? Her One Health program at Rutgers is currently examining ways to incorporate these disciplines.
Thank you. That's great question. Absolutely. And just within the last 2 weeks, I had at least 2 or 3 meetings with arts and humanities groups, and I was giving them, even in fact, our Ethiopia partners. One of the examples I gave is on our rabies. Rabies is a very old disease, classical disease. There is effective vaccines, but many children, particularly children, die in many sub-Saharan Africa or India as well. Awareness is key. And one of the things the University of Gondar did is they have their Department of Theater. So the Department of Theater came up with a plan for awareness purposes involving arts and other things, which is great. I was encouraging our team members here in arts and humanities also, in our various other priority areas, how we can partner. We have a medical arts program as well at Ohio State. So has not been highly involved on the One Health, I can tell you, but I had a meeting with the medical arts program between arts and humanities and medical to do that. And my other thing, which I did not mention throughout, but I have to mention is, remember, we're not just doing international One Health, it's global One Health, which our core aspect is Ohio State. We are a land-grant university. State of Ohio is a key part of our initiative, and we have few projects in Ohio. And we were discussing just 2 weeks ago also on opioid crisis, of course, a bit distant from our One Health activities. But within Ohio, opioid crisis is big, and we're discussing with the lead dean of our Dean of Public Health in terms of how we deal with that, and involving, in fact, there was a proposal he showed me from a Greek arts, the way how the Greek art system against addiction, which is interesting. But I can go on and on. But yes, that's an excellent question. We would love to, and that's part of the discipline I mentioned to you from the 13 colleges, includes our arts and sciences programs.
Great. Thanks a lot for answering that last question. And thank you again, Dr. Gebreyes, for the talk today and taking time out this afternoon to share some knowledge. I think you've got a great perspective and provided a lot of great examples of what Ohio State University is trying to do in the global One Health scene. So thank you again.
Thank you. You're very welcome. Thanks, everyone. Appreciate it. Thanks
everyone for attending. And we'll hopefully catch you at some point soon at future webinars. Thanks.
Great. Thank you. Okay. We'll see.